Controversy over U.S. Defense Secretary Lloyd Austin's health continues, and it's not going away. Surrounding his now disclosed illness, it has put the White House also in a very tight spot after days of uproar among lawmakers. On Tuesday, U.S. officials disclosed that Austin was getting treated for prostate cancer and is recovering well. The news came with a series of questions and embarrassing justifications from the White House and Pentagon officials. The chief of staff and senior Pentagon officials have ordered a protocol review of last week's event. This is what U.S. officials have said so far. Take a listen before we continue.
It is not optimal, Gabe. It is for a situation like this to go as long as it did without the commander-in-chief knowing about it or the national security advisor knowing about it, or frankly, other leaders at the Department of Defense. That's not the way this is supposed to happen. The president understands that, and that's why he wants the chief of staff to take a look at processes across the administration and agencies here, and that's why DOD is also looking at their own procedures to make sure that that doesn't happen again.
Review will help us understand where we can do better in terms of making sure that part of the notification timeline, not only to include the chain of command, but also the public notification timeline, is taken into account. I don't, and again, we're talking about a hypothetical and I'm speculating here, and as a public affairs official, I can tell you that I don't see a scenario whereby this happens and there's never any public acknowledgement about it. But in terms of the timeline and how we get to where we're at the point of, okay, it's time to let the public know, clearly we could have done better and we will do better.
White House and Pentagon officials said they also got to know about the cancer only on Tuesday, meaning yesterday, and within minutes, the public and the press were informed as well. The Pentagon said the failure occurred because a key staff member had the flu. White House Chief of Staff Jeff Zients has since directed members of the president's cabinet to provide notice when they cannot perform their duties. The Walter Reed Medical Center also released a statement. It said Austin's prostate cancer was detected in December during a routine health screening. On December 22nd, the defense secretary underwent a minimally invasive procedure for his cancer that was still in its early stages. According to the hospital, Austin is now recovering well and was discharged back then soon after. Problems started around the new year when he was readmitted on the 1st of January due to complications from the procedure that turned out to be a urinary tract infection. Austin still remains in the hospital and will be sent home once the infection has completely cleared. The 70-year-old defense secretary faced flack last week after it was reported that senior officials, including President Joe Biden, did not learn of his hospital admission for 3 whole days. His deputy, Kathleen Hicks, was also not informed of his hospital stay, despite being asked to assume some of his responsibilities. Austin has since apologized for not informing the White House appropriately, but that has not stopped the uproar among lawmakers. After the news came out, Republican lawmakers called for Austin to testify. Some are demanding his dismissal. They say such breakdown of communication is unacceptable. Lawmakers also demanded clarification over his health and hospitalization.